everybody. Welcome to Two Feet Told Podcast. My name is Erica and this is Brandy.
What's up? What's up, guys?
If you guys are joining us for the first time, our podcast is focused on providing underserved and underprivileged communities, particularly communities of color, with the information and tools to improve their dental health care experience.
Yeah, you got it.
So, you guys, we are winding down on our restorative healthcare series. So today we're going to talk about veneers. So we had an episode where we talked about veneer technicians and different things that happen with that, like people who basically are
Mhm.
doing veneers and are not qualified to do it.
Mhm.
But today we're going to talk about the actual veneers and what real people who are really supposed to be placing them do. That's
With
exciting, right?
the
Okay. So
that
Brandy,
is
my it is. So Brandy, my first question to you is what are veneers?
okay. So veneers they're kind of like coverings that go over your teeth. So for the ladies, if you've ever had like a full set of acrylic nails done from scratch, like not a refill, but when you get
Well,
okay,
this is a
Erica.
refill.
That's Erica head. Okay, that's okay. But you know how you get the little your nail on first. They glue the nail on to
Yeah,
get the one you
before if your
want
nail
it
was short, right? Yeah, yeah.
short. You want a long, stiletto perhaps. You get that put on there. That is exactly what a veneer is like. It goes on the teeth in the same way. So it's kind of like a thin covering on the outside of the tooth. So, um, and it covers the front surface of the tooth here. So of course it can be colored. You can pick the color, or should I say, to match your other teeth. Most people usually get veneers to span from one side to the other of the arch so that everything's nice and uniform, but it's really a option for anybody who's interested in aesthetics and having their smile be brighter, whiter, and more aesthetically pleasing.
Okay. So, Brandy, how do veneers work?
Okay, so I kind of said this, but yes, they cover the front surfaces of the teeth and they enhance your smile. So they work by like camouflaging your flaws there, those cosmetic flaws that you have.
It makes it look like you have perfect teeth. So, okay. So, who needs dental veneers?
So this is going to be anybody who wants to enhance their, appearance of their smile, right?
Mhm.
And you want to camouflage some of certain dental restorations or restorative work that you had. So if you have any chipped or broken teeth, if you have any spaces in your teeth, also known as diastemas, some people get, if you have gaps or spaces in between the teeth, instead of getting braces, if the gaps are small enough, they will use a veneer to fill in the space instead. Um, Not always the best because then it can make the teeth look larger than they really are. But
Uh,
if the space is small, it can be a good thing. Or if you have misshapen teeth, or by misshapen I mean people who have these would know what they are, but some people have peg laterals. And so those are teeth, usually, well, they're lateral incisors. So they're your top teeth in the front or bottom teeth, and they're shaped like a peg. They're not tooth shaped. And so you can have a veneer placed so that it looks like the tooth is a naturally shaped tooth. And if the teeth are too small, so say you got small
like fish
teeth,
teeth.
gummy smile or whatever, they
Yeah.
can. So you can also have that. And also if you have stained teeth that whitening can't touch, whitening's not going to improve. So this will help brighten and
All right.
whiten.
So, are there different types of veneers?
Yes, there are different types.
Go ahead,
So
girl.
we have the composite veneers and we have porcelain veneers. So composite veneers, they will conceal like mild cosmetic issues. And basically, the dentist will use like a tooth colored composite material, the same material that's used for tooth colored fillings or white fillings. And
Mhm.
and it's also the same material used when you have bonding. People say, "Oh, I need a bonding," which is basically a glorified filling, but it's the same material. Bonding is usually done on a front tooth. Um, but he's going to use that material to achieve the desired look, and he's going to manipulate it so that it looks like a tooth and is shaped like a tooth. So for this one, there's very little tooth structure, if any, that needs to be removed, and then that'll be on there. And then the porcelain veneers are exactly that. They're porcelain. Porcelain is used a lot in dentistry, and so this is going to, fix a lot more complicated looking issues. And these are custom made for you and your anatomy. So you'll have impressions done, and they'll make the veneers at the lab for you. And so it takes a couple of weeks, just like when you have a crown made. In the meantime, they'll put a temporary veneers on, just like you would have a temporary crown. And then when you come back to get the permanent veneers, they'll pop those off and then they'll put the other ones on. For this one, your teeth have to be roughened up. The surface of the tooth has to be removed, the very front surface, the enamel, so that the veneer has a place to sit. And
And
then,
you can't go back, right?
so this is irreversible, correct? So
Yeah.
once you have this is done, these are irreversible. Both the composite, the porcelain, done and done. Um, but you also have no prep veneers. So these are probably like the less invasive option. And so like the traditional veneers and the porcelain veneers, they are custom made for your smile. They just require less of that enamel to be removed than the traditional veneers. Okay, so it's important that you understand they still require some enamel removal. So this does as well. They're not good for everybody, so you just kind of have to figure out what your dentist what is going to be best for you. And lastly, there are the removable veneers. These are kind of like those things that you used to see on TV, like the pop-on, snap-on veneers. You just snap on, they cover your natural teeth to high
My dad
perfection.
had that. He had that, but then he now has it. It's I don't know if it's permanent or not, but he did have a snap-on thing. It went like kind of like a
Yeah.
thing.
So they're like retainers. There's nothing, you don't have to remove anything for this.
Yeah.
They come out there, they'll enhance your smile, but they might make it be hard to eat with because it's kind of like a retainer. Um,
Yeah, that's what it reminded me of. Like, yeah, yeah, yeah.
that's what it's like. And then also it can inhibit your speech, just like a denture or a retainer might make you feel, or
Yeah.
if you're using bleaching trays or something, those
Hmm.
things might make you sound funny when you talk. Um, they've been around for a few years. I don't recommend, but some people have done it. Like Erica said, her dad had it.
He did, and then he switched. She has like
Yeah,
they're
first
not
year done.
removable any longer. Yeah.
Hmm. Yeah.
So
Hmm.
all right. Okay. So last but not least for this part,
Hmm.
because we're gonna have to break this into two. So this is my last question for you for this episode.
Yes,
This
ma'am.
goes into the procedure details. What happens before dental veneer placements?
Okay, so you have to get your X-rays and your exam. We do a exam of the teeth as well as an exam of the gums and the bone, just to make sure you're a good candidate and that if you are, everything's healthy because we're not putting slapping veneers on no rotten teeth. I know people be coming in, I can't you just put veneer. I'm gonna need you to get your fillings, to get that, gingivitis and periodontal disease in check prior to placing restorative treatment, especially aesthetic cosmetic restorative treatment. You want it to look good, you want it to be on a healthy foundation. So all of that has to be done. And then once everything is nice and healthy, they take impressions, just like I said before, so that you can have your veneers custom made by the lab. It takes a few weeks for the lab to custom make them. And in the meantime, you'll wear the temporaries until you get the permanents. And yeah, that's probably it in a nutshell.
So, guys, tune back in next week for episode part 2 of this of veneers, the restorative series, so you can find
Yeah,
out about this. Yeah, like I was just wish. Yeah, it's going to be some stuff.
to
So,
finish
all
it up.
right, guys, tune into our website, tobetoldpodcast.com. Shows all of our socials,
Mhm.
IG, YouTube, You
Mhm.
name it, all the socials, Facebook, da, da, da. So, Brandy,
Yes, hit us up. We will see
anything else?
you
Okay.
shortly.
Yes. All right. Thanks, guys, for tuning in. Check
All
you
right.
out
Take
next
care.
time. Bye.